Hey everybody, it's Connor Kays, and today I'm going to be talking about lotus birth. So lotus birth is a pretty strange practice that probably a whole lot of people haven't heard of. It was first started happening about a couple hundred years ago in kind of in Australia and New Zealand, but there's even been some reports of it happening in the pioneer days of America. The first actual reported event of it happening in a hospital occurred in Australia in 2004. So what lotus birth is essentially once the baby's born, the umbilical cord is not clamped or cut, and it's birthed along with the placenta and left attached until those two pieces dry up and fall off spontaneously. So care for the newborn with or following lotus birth, it's essentially the same. Whoever's providing care, the nurse, family, whoever, they would definitely want to try and remember to practice strict hand hygiene as you would with a normal baby, just because the baby after lotus birth could have a higher chance of infection. Another thing is to make sure you dress the baby in loose-fitting clothes that button up in the front, just so that way it won't aggravate the placenta and trying to tug or mess with the placenta or the umbilical cord. Another thing is care for the umbilical cord and placenta. So how that's going to happen is essentially once it's all birthed, the placenta is going to be left out and not in an open air for 24 hours so it can drain thoroughly. After that, it's going to be wrapped in a loose cloth to kind of keep air circulating. And typically it's going to be rubbed down about once or twice a day with some kind of salt and herbs just help it kind of dry up a little bit quicker. Typically they want to leave it in a ceramic bowl just that way a ceramic bowl is used just because it helps redistribute heat and everything more evenly. There are some risks to lotus birth. So one big issue is with the fact that some people believe that it puts the baby at bigger risk of infection. Another issue is that if the cord is to become pulled on or become detached too soon, it could cause trauma to the baby. Some of the benefits is that there's some proponents that think that lotus birth actually enhances the immune system of the baby, because once the baby's born, because the cord isn't clamped or cut, they essentially receive a transfusion of blood after they're born through the umbilical cord. Another benefit is that they tend to say that babies born with lotus birth are a little less fussy in that newborn period, and it also is said to increase bonding because they still have that kind of physical attachment to the mother. Some of the legal issues is the biggest legal issue is the fact that a lot of hospitals don't have a policy around lotus birth because it's not something that's typically requested. The biggest thing for the nurse is just kind of be the advocate for the patient and try and respect their wishes, but also try and do what you believe is best for the patient. Another legal issue is the fact that once the placenta and umbilical cord are birthed and attached to the baby, there really can't be any kind of diagnostic test performed on it, the umbilical cord or placenta, because it could put the baby at a high risk for infection. So the biggest ethical issue with lotus birth is the fact that there hasn't been a whole lot of research done supporting or against lotus birth. So like I said, it's important just for the nurse to be an advocate for the patient, and education is one of the biggest things you can help these parents with, especially with dealing with a newborn after lotus birth. But at the same time, you want to be an advocate for your patient, but you also want to be there to protect that vulnerable population of that newborn. So that's all I got for today. Thank you.